So we are going to go ahead and get started. We are crossing our fingers that the rain and the lightning that we're having here doesn't cause any problems. But thank you so much to everyone who has joined us. We're going to do a quick little sound check and just make sure that everybody can hear us. If you can hear us, please say a quick yes in the chat box. All right, yay, so glad everybody can hear us. So I want to introduce myself. My name is Christy Lafferty, and I am the director for our inspiration team at AMOS, Health and Hope, and we're really excited to have everyone here tonight for this webinar. And our topic is the ethics of missionary work in Latin America. Our power just went out, but we have a backup battery, so hopefully we'll be fine. I think that most of you on the call tonight know AMOS, and we are so glad to have so many friends and people we recognize on joining us tonight. But if you don't know who AMOS is, we just want to quickly say who AMOS Health and Hope is. We are a nonprofit Christian organization that was founded 10 years ago with the mission of improving the health of impoverished communities by serving alongside them in health, education, and development. In case you are interested in learning more about AMOS, we have our most recent annual report online, and you can check it out at that link. So I am so honored to have a couple of amazing people with us tonight. Tracy King Ortega is a mission coworker serving as the regional liaison for Central America for the Presbyterian Church. And she has been serving for almost 20 years with the Presbyterian Church and living in Nicaragua for most of that. And so we're so excited to have her here. And Dr. Laura Parajon is one of the co-founders of AMOS. She's an American Baptist medical missionary, along with her husband, Dr. David Parajon, who unfortunately had a last-minute change in his schedule and had to be out of Managua today. He says hello to everyone, and he was sorry to miss this, but he is also with us in spirit. So just a little housekeeping. We're gonna have you check for the chat little window on the top left-hand side of the screen. You should see a little button if you haven't found it yet. And make sure to turn on next to the word "to" all panelists and attendees. That way your chat will be seen by everyone. But Lydia, one of our staff, Lydia Caldera, is manning the chat box, so she's going to answer any questions that we have there. So we are going to start off tonight with a little quick poll. You should see a screen pop up at this point, and we wanted to ask you as a question just to get to know a little bit about the people we have on the call. So go ahead and take a second to answer the question, have you ever been on a short-term mission trip or a service trip? Just select the answer that most applies to you.
Sí, ahorita ya no van a encender mi. Ya le di.
So we're going to give, okay, sorry. Everyone should see the choices now on your screen. So go ahead and take a second to pick the answer that applies to you. All right, we'll give everybody a few seconds there to pick their answer. Okay, it's like almost everybody's gotten a chance to answer, so just give it a couple more seconds. All right, we're gonna go ahead and close the poll, and here's a little bit about everybody who's on the call. So most of you have been on an international mission or service trip out of your country, and or also been on some missions or service trips inside your own country. So That's great. Thanks everyone for answering. So we are going to share one more question with everyone. Just give me a second here. Okay. All right. Sorry. There we go. Okay, now I want to ask one other question here to everyone, which is related to the topic that we are talking about tonight. So how much have you reflected on this topic about the impact that international short-term missions have, either good or bad? Go ahead and take a second to answer that question. All right. Okay, it looks like most of everyone had a chance to vote, so we're gonna go ahead and stop the polling in just one more second. All right. So it looks like most of everyone in the call, everyone's thought about it a little bit, and a lot of people are kind of in the category of having read some articles, books, had some good conversations. And we've got a really great group of people that have studied this topic a lot, either on your own or academically. So that's awesome. We're really excited to get this going. Okay. So, getting into the meat of what we're going to be talking about, I want to just say that we don't presume by having this webinar tonight to be the total experts on this topic. We're not going to be able to cover the full complexity of the ethics of missions and all of the history of missions in Latin America. We're going to give a brief history and a context right now to our conversation, and then we're really going to hear from Tracy and Dr. Laura to have them share from their perspective as individuals who've been involved with missions and as professionals in their fields. So when we talk about Christian missions in Latin America, really for the largest chunk of time that is related to the colonization of the Americas and just kind of the bringing of Christianity to the continents of the Americas. That first happened with Catholic missionaries. It was very tied to Spanish colonization and the Vatican, the Pope, in the late 1400s, there was basically an official agreement giving the Spanish kind of full reign over the New World. And so in the same period of time, the Protestant Reformation was really just beginning when the first wave of colonization was happening. And in this period of time, the people who came, the Catholics that came bringing this, were mixed in with a lot of, there was a lot of mingling of the colonization, which had a very well-documented history of violence and oppression of the peoples who lived in the Americas before the Spanish arrived. And so people were converted to Christianity, but in a context where they were considered, for the most part, as barbarians, and that kind of terminology was used. And many of the local, peoples were made slaves. And so that's just important to keep in mind in this context, because the effects and the history of colonization and they still remain today. And Tracy and Dr. Laura are going to be speaking to that a little bit later. And so in terms of Protestant Christian influence in Latin America, when and where did that begin? We see that really it didn't start happening until the mid to late 1800s. And this coincided directly with the wave of countries in Latin America gaining independence from Spain and Portugal. The new governments that were starting to emerge that were independent countries now, their leaders had the perspective of wanting to break away from the dominance of the Roman Catholic Church. And so they really opened the door in many ways to missionaries from Protestant Christian faith. And this also coincided with the US policy in 1823 of the Monroe Doctrine, which basically was a statement to say the United States doesn't want European countries meddling anymore in the Americas. And so that was the context in the early 1800s. And in Central America specifically, we're going to be speaking to a lot related specifically to Central America. As the Panama Canal was being built, this is a time when we saw a special increase in Protestant missions in Central America. And there was a specific Congress that happened in 1916 where many of the Protestant mission sending agencies actually gathered and kind of divided up where a lot of their efforts were going to be concentrated. And this is sort of seen as like to reduce competition between the different Protestant denominations. But there were a lot of individual missionaries that have been sent by different denominations, and they already had a presence and had been established. And so it kind of where different denominations ended up focusing their efforts after 1916 was related to who was already there. And so for a lot of the Protestant missionaries who were in Latin America in this time, they definitely had a focus on evangelism, but there was also a definite social mission focus. There was a lot of building of schools and hospitals and later on theological seminaries. And so that was definitely a significant piece of the context of the Protestant missions in Latin America. We do want to make just a special mention since we are in Nicaragua, and Dr. Laura and Dr. David served for the American Baptist Church. We had some women who were pioneers in Nicaragua as missionaries. Dora de Moulin, am I saying that right? Yeah, in 1886. And then Eleanor Blackmore in 1903. And this year, actually, 2017, is the 100-year anniversary of the First Baptist Church of Managua here in Nicaragua. So these women were supported by Baptist Women's Mission Societies, and they had a huge role in supporting this early missions work in Nicaragua. So why is this important to look back at? I think that, we just want to share that context and history because we need to understand it to see where we are right now and how the perspectives that we bring and the local people, these interact whenever we go outside of our own culture or country. And so we just feel like it's important to keep these in mind within the discussion this evening. I'm going to go ahead and turn it over to Tracy, who's going to share some about her story. So take it away, Tracy.
Thank you. So I am certain that I was the most prepared high schooler to ever go on a mission trip. I went down to the local hardware store, bought myself a tackle box, and proceeded to stock it with everything imaginable. Q-tips, wet wipes, rubber bands, duct tape, medicine, you name it, I probably had it. I wanted to be ready for anything. 13 years old and a freshman at Palos Verdes High School in one of the wealthiest suburbs of Southern California, I was active in the church youth group and counting down the days for the annual mission trip to Mexico known as Easter Project. For months, we worked hard fundraising for the trip, organizing the 100+ youth into work teams and family groups, pre-trip meetings with the parents, and packing. Looking back, I had almost forgotten about that tackle box. Nowadays, when I travel to another country, I'm lucky if I remember to pack my toothpaste. Decades of living and serving in Latin America have changed me. Really though, many of the details of those first mission trips have faded from my memory. However, I can't shake the memory of returning home after one of those intense weeks of service and learning and feeling so incredibly out of place and uncomfortable when I returned to the comforts of my own home. Why is this moment seemingly burned into my brain? What sticks with me is not coming back and feeling accomplished for the good works we had done, but rather how this mission experience made me feel and the questions it left me with. I was touched by poverty. In contrast to where I grew up, I found it hard to comprehend how not but 3 hours down the road and across the border, a family of 5 was living in the back of a black station wagon covered with a blue tarp on the edge of a dump. We spent a week working with the family to build them a house and hear their stories. I remember the father working harder than any of us on that house, emotional to see an unimaginable dream of a dignified living space for his 3 girls become reality. Getting to know that family transformed my perspective. Growing up, I came close to missing the reality of poverty and marginalization around me and in the world. I'm so grateful that my early mission experiences not only exposed me to poverty, but began framing questions about justice or the lack thereof. I do believe that is what set me on a course for a lifetime of asking questions, learning, and wanting to work towards lasting change. And now, 2.5 decades later, my understanding of mission has matured. It is now more complex and nuanced, but the essence of that first mission experience remains. God's call to mission calls us to step into uncomfortable places. Mission involvement exposed me to other realities and opened up my world. The definition of family suddenly got bigger. These were all God's children, and we are bound together in Christ. I continue to hear God calling me to take these short-term mission experiences and go deeper. In college, on a semester-long study service tour through Central America, we studied the history, politics, and economics of the region. I learned about my own country's involvement and influence and began to question structures and systems. But I also heard stories of faith and hope from the people I encountered and was taught a new way to understand God. Amid military dictatorships, war, and abject poverty, people were studying God's word and seeing their lives and communities transformed by it. The Bible taught them that God is a God of justice, who wants to see all people live with dignity. As testimony to that, I visited with Christian-based communities and nonprofits who were empowering marginalized communities to make their lives better. Inspired by Jesus' ministry, people who have suffered centuries of oppression, lack of access to land and education, were now organizing and working for lasting change. Seeing the gospel message come to life in this way left its mark on me. I kept finding ways to go back. I wanted to go back to do good and make a difference. But given my experience and what I had learned about the history of my own country's involvement in the region, I could no longer naively think that I had all the answers and that it was up to me to fix the problems of the third world. What I felt I most had to offer was to serve as a bridge or a facilitator to help others gain a broader yet deeper understanding of the context. So eventually I did find myself moving back to Nicaragua as a full-fledged missionary, but not to do your typical missionary kind of thing. I was sent to host mission teams and facilitate long-term partnerships. I did that for nearly 5 years, and now for the past 11 years, I've been serving as regional liaison for Central America for the Presbyterian Church USA. As a Presbyterian mission coworker, I feel good about how we have evolved over the past 180 years in the way that we do mission. In contrast to the violence of imposed Christianity during colonial times, Presbyterian International Mission tried to give voice to the social message of the gospel. We sent people to teach, preach, and heal by establishing schools, churches, and hospitals. However, it was predominantly about us doing good for them. The way we do mission has evolved tremendously since then. Today, we engage more intentionally in a mission of partnership, coming alongside local Christians who are best able to discern God's work in that place. As part of this changing face of mission, I am proud of my denomination, which places people like me in positions designed to facilitate healthy mission involvement. As regional liaison, much of my energy has been invested in accompanying others and facilitating experiences so that mission won't be focused on what we accomplish, but rather on maximizing the potential for mutual transformation. I try hard not to be a glorified tour guide when hosting mission teams, and to not just provide opportunities for a feel-good ministry that merely responds to needs created by poverty without seeking to understand why these people are impoverished. I understand my role as one that serves the church, helping build our capacity to become a community that transforms and is transforming rather than just provide services. Foundational to the work I do is the understanding that mission is best done in partnership. When I work with mission teams, I always insist on scheduling time for a coyuntura. There's no good translation for that word, but essentially it is a presentation about the country's history, politics, economics, current affairs, etc. Even for groups that come year after year, this is an essential piece. Understanding the context of the place we serve is important because we are all products of these histories, Nicaraguans and US Americans alike. We hear about colonization and agree that it was bad, but we don't often stop to think about how that history continues to impact us today. We don't see ourselves in that narrative, but truth is, it has shaped our identity and how we see the world. I see it all the time when Nicaraguans insist that because a product comes from the US, it must be better. The way in which my Western culture rushes in to identify needs and fix problems before really seeing and listening to the people is a byproduct of centuries of being in control. If we are to work together as equal partners, we need first to understand all that makes us who we are, which, whether we like it or not, includes a long history of violence and domination, and myths of inferiority forced upon people to dominate them. The relational power dynamics that have resulted are the opposite of what God desires for humanity. And I found myself reflecting on these ideas a lot lately. I think if mission is about building God's kingdom and hold that together with our sordid history, then perhaps God's mission today should be about the transformation that can happen when we strive for true partnership. The how we do mission can be more important than the what. Perhaps we can't fully shed our Western viewpoint, but my hope is that our involvement in mission will help transform it. So more on this idea of doing mission in partnership. I want to share with you a testimony of a pastor in Southern California who has been active for more than 10 years in a partnership with a rural cooperative outside of León here in Nicaragua. Whenever a team comes to visit from the US, we have them spend a day or two in retreat with their partners, learning about each other and planning next steps for their partnership. She writes, "At the end of our first day of retreat, one of the cooperative leaders said, 'You know, this has been an amazing day. Not once did I feel less than any of you. And we are ignorant. We only have a third grade education. And you all have education and all these skilled jobs. But not once did I feel less than you today.' And I remember thinking to myself, they only have a third grade education? They have been so much more articulate than we have the entire day. I had known that, but my experience that day made me forget that. Because that day, through skill and formation, the playing field had been leveled. And it changed me to understand that the humanization of mission is essential, not only for the transformation of communities in poverty, but of my own, of me. There was so much joy in this, so much joy in me being released from what I hadn't even known I had been held captive by, which was my own biases, prejudices, racism, imperialism, of my own inability to see. It was a seminal moment in my understanding of what was essential in mission, and it made me want to go back and redo all the mission I had done in the past. These words speak to me deeply and affirm the power of doing mission in partnership, and how it must be a guiding principle to our mission involvement. I think it's where the real difference can happen. But then still begs the question, what can we do? After all, it is the poverty and needs that we see combined with our desire to do good that drives us. We want to be helpful, to make a difference. Now, clearly, I think we offer so much more in our being than our doing. But that isn't to say we don't have anything to offer. With partnership as our guiding principle, I think first and foremost, we must identify, work with, and defer to our on-the-ground in-country partner. They are the best at discerning needs and effective strategies to address them. At times, we may have a particular skill or knowledge or some knowledge to offer, and that can be helpful. And I suspect Dr. Laura will speak more directly to how we can put those skills to use. But I don't want us to lose sight of the mutuality and partnership. We may sometimes have something tangible to offer, but we always have something to learn or a new perspective to gain. And perhaps not so tangible, but maybe one of the most important contributions we can make as North American Christians to places like Nicaragua is hope. How often do we hear people question if the money invested in taking a mission trip is worth it? Couldn't that amount of money go so much further if it was invested directly in a project? I remember after Hurricane Mitch, when Nicaragua was absolutely inundated with mission teams in an effort to rebuild. A team I worked with asked this question of Dr. Gustavo Parajon. He was very clear in his response that absolutely the money spent on these trips is worth it. He was referring to the value of hope. Your testimony in time, money, and a willingness to rough it in order to be present in these communities can bring hope to people who feel forgotten. You can't put a price tag on that. I believe deep down that everyone is called to participate in God's mission. I also believe that mission is not just something we do, but it is who we are as followers of Christ, as builders of God's kingdom. I may also dare to say that God calls us to mission, not just to transform the world, but to be transformed ourselves. The mission work we are involved in doesn't transform us. Perhaps we need to reassess how we are doing mission. Mission, when done right and focused on relationship first, can lead us to wholeheartedness. It can help us understand and experience our humanity. Cross-cultural experience breaks us. If we challenge ourselves to go into the other space, we are vulnerable and God will touch us and transform us. Addressing the root causes of poverty should break our hearts, but it can also fill our lives with joy when we mutually give and receive, teach and learn, and witness the transformation that happens when we no longer limit God by just becoming preoccupied with doing good.
Thank you, Tracy. So we are going to let Dr. Laura have the mic now and share a little bit about her story and the AMOS model of doing short-term and short-term missions with long-term ministry in mind.
Awesome. Thank you, guys. Thank you so much. It's so awesome to see the list of all of you on the webinar. So excited. Thank you. And it's amazing to hear from Tracy and Christy. As Dr. Bob McElroy says, I'm only a simple doctor, so we'll see what I can share. So as you can see in the picture, David and I have been medical missionaries with American Baptist International Ministries since 2001. So if you can believe it, we've been here for 15 years. And from the picture, you can see our kids were 9 months, 2 years, and 4 years old at the time. And now they're 16, 18, and 21. So that's pretty scary to see how quickly they've grown. Like many Chinese people, I don't know if you know this, my dad just wanted me to be happy and a doctor. My dad was a doctor who came to the US basically seeking a better life in post-war Taiwan. So actually, he was a little bit sad when in 2001, David and our 3 kids and me moved to Latin America, which is the second poorest country in Latin America, which is way worse than Taiwan is now. And instead of driving to work in my nice minivan, which, by the way, I brought to Nicaragua, and my kids are still driving, this is how it can be sometimes in Nicaragua, especially when it rains, and thank goodness it stopped raining right now, and you don't hear the beeping anymore. Anyways, what I found is that missionary work has been the hardest job and the best job all at the same time. It's the hardest job, I think, because you have to do so much with so few resources. And it's the best job because, as you can see from this quote, I get to work with committed and dedicated people like all of you in this webinar and all our staff at AMOS, and also to learn from and be inspired people like Juan de Dios, one of our health promoters and and teachers here. And he says, if our lives are a true reflection of what we believe, then we can take action to help others and make a difference in our communities. And this is Juan de Dios. He makes less than $2 a day, and he is teaching us about what it means to be a Christian. I'm also inspired by the Christian ministry of Martin Luther King, who says, of all forms of inequality, injustice in healthcare is the most shocking and most inhumane. So another reason I'm here is because David grew up as a missionary kid, and you can see how cute he is in that little picture with his mom and dad when they came in 1967. And unfortunately, he can't be here to tell a story, so I'll tell it for him. They drove from Ohio to Nicaragua, and from what I understand, he fell into an empty pool at one point in time, and always tells that story that sometimes has memory loss, but that's just a joke. Anyways, you know, Gustavo was an amazing missionary here. And in fact, Gustavo and David, when during the Contra War, they actually went to one of our communities that had gotten killed. One of the promoters and 2 health committee members were killed during that time, and they went to accompany them. So just to show like the importance of accompaniment during this time period, and the community still remembers that. Anyways, Gustavo was one of our mentors, and he taught us one of the most important lessons that we have being medical missionaries here. And he was a missionary who started the first vaccination program here in Nicaragua, and also the first community health worker program here, and taught us that, you know, when we first came here to Nicaragua, I thought it would be like super cool and get to do all this cool missionary stuff, like, I don't know, do all this medical stuff. But he actually shared with us that being a medical missionary and working in a different place is more about teaching others and empowering others to do things for themselves, and not so much about us doing stuff. So Christy also mentioned Dora Dumoulin and Elizabeth Blackmore. What's amazing is that David's grandfather, Arturo Parajon, also started the First Baptist Convention here in Nicaragua to bring together all the churches. And actually he was like a contemporary of like Dora Dumoulin and Elizabeth Blackmore, just to like say like, hey, this is pretty amazing. You know, there's a lot of work that's been done over time and really partnering work here in Nicaragua. Gustavo was also part of one of the most important movements for health in the 1960s. He was part of a group from the World Council of Churches who formed the Christian Medical Commission. And this group was an amazing group that thought, is there a better way to advocate for health? And rather than focusing on defeating death, they were trying to focus on how do you strengthen life? Because all these medical missionaries who were all around the world found that despite having these amazing hospitals, kids were still dying in rural areas because healthcare wasn't getting to the people who needed it most in rural communities. So the idea was that the Christian Medical Commission started doing all these amazing things like training community health workers, bringing healthcare to the people, and working with the people alongside them. And this groundbreaking work of these health professionals formed the basis of one of the most inspiring documents in public health and primary healthcare today, which was the 1978 Declaration of Alma Ata. And it was a conference where, like, if you can see, there's like all these people from all over the world in the World Health Organization, and they established that health was a human right and that it was going to be equitable, appropriate, and effective basic health care for all people. Another one of the amazing medical missionaries that we got the opportunity to learn from was Dr. Carl Taylor, and he was also there along with Gustavo at this conference, and he coined the term health for all and actually shared it with all his students to say, yes, we were there, you know. And so it's really amazing to see that, yeah, you know, medical missionary work all around the world has improved healthcare as well, you know, having that voice for the poor, for the people who need it the most. So I think that's a history that's often forgotten, and I just wanted to mention it because I think it is important when we talk about what is the contribution of medical missions to public health and healthcare in general. AMOS as an organization is built off the contribution of all those who came before us. It's a culmination of many learned lessons from all of our great mentors, including Gustavo, Carl Taylor, Warren Hepburn, so many people who have been our mentors over time. And AMOS was founded basically as a Christian nonprofit to be able to develop empowering approaches to address healthcare inequities in Nicaragua, where children are 3 times more likely to die of preventable illnesses than those who aren't poor. And like as Tracy said, the what of what we do is just as important as the how, and they're both important. The what of what we do is community-based primary health care, which is based off of Alma Ata. It's an integral approach. It trains community health workers from their own communities. We use evidence-based interventions because as Christians, we do want to use the best thing for people, you know, and we work on 3-way partnerships, governments, communities, and outside facilitators, all working together to empower and improve health, to reduce health inequities. If you look at the model that the Christian Medical Commission came up with, is that the old model was mostly like physician-based and the new model is more community-based. It involves more community-based work. And so that kind of, I mean, this is a little chart that you can look at, but it's looking at more low-cost, preventative, and empowering ways to improve health. AMOS also stands for Ministry of Sharing and stands for the prophet of Amos, who was a farmer who fought for social justice and believed in that vision of standing for the poor. And so that standing with and alongside the poor, which is what AMOS is based off of, right? And so if you look at one of Gustavo's favorite verses and one of ours is that in Luke 4:18 to 19, you know, he has sent me to proclaim freedom for the prisoners and recovery of sight for the blind, to set the oppressed free and to proclaim the year of the Lord's favor. It's that message that we're working alongside the poor, and it's a message that we should all, you know, be listening to say, yes, we can do this, and we're motivated by God's love to serve the poorest people. So how does then short-term missions blend with our long-term impact? And I think that's one of the things we feel at AMOS. That's one of the things we've been doing, I think, well, you know, we're trying to blend the strengths. And what do we as foreigners, we're very intentional about this. We're not working on people or for people, but with people and all of us together. So what kind of strengths and resources do we bring to the table to blend in with the strengths and resources of the people we serve alongside, wherever we may be, whether it's in Nicaragua or Africa or wherever we are? How are we blending those together? Because we each bring something to the table. We've really seen how, like, if we have people, so all of us together with the communities, with governments, and we have those principles, those strong Christian values of love, service, helping the poor, you know, being in solidarity, and we blend them together with shared responsibility, we can make a real impact in meeting the physical needs of people with things such as the water filters, clinic consults, essential medications, in meeting emotional needs with like our support groups and health education training, and spiritual need with accompanying prayer and being there for people when they need it. That beauty of all of that together, bringing physical, spiritual, and emotional health together, is what we feel is how to blend short-term with long-term missions. One of the other things is that, you know, it's not a short-term thing, like you can see. This is long haul work, right? Accompaniment, loving others. I think there's a point at which I was like, well, I wonder, you know, when we're going to be done with this, but it never is going to be done because, you know, we need to keep on fighting for health inequities, for reducing health inequities, for fighting for the poorest people, to making a difference in our world. So just to end, I want to share a little thing that when I was studying part of my public health master's, and after I got my medical degree and everything, I was doing my public health, and we were doing about health, we were learning about health system, and it just seemed really hard. Like, you know, what can I do to make a difference here? You know, there seems to be so many things working against us. And my professor just turned to me and he said, you know what? The question isn't what can I do? You know, he said, the question is how much of your life are you willing to give to promote health, to promote dignity and an abundant life for all people. And I think that's what's the beauty of having the privilege of being a missionary here in Nicaragua, working alongside the people in the communities and all of you, is that honor, that privilege of being to give of your life, you know. And I want to end with my hero, because Timothea has been my hero. She's one of our health promoters. And she had to make the most difficult choice when she became a health promoter. Her husband threatened to leave her because it's a very machista society here. And he told her that if she decided to become a health promoter, he would leave her. And she prayed so much about it, and she worked with our supervision team, and she finally made the choice to be a health promoter. And she saved the lives of so many kids and so many moms in her community, but she paid such a high price for it. And whenever I think about Timothea and her work, I think my choice that I made is so much less than hers. Like, she taught me, she teaches me about motivation, about true Christian motivation. She teaches me about what it means to be a Christian in this world. And that's what I think is the beauty of short and long-term missions, is that we learn from each other, we bring our resources together, and we make a better world, you know. And we don't have all the answers, you know. I think that's, you know, a thing we struggle with is, you know, we don't have the answers. God has all the answers, and he guides us, and we hope you guide us as well. And that's what I think this is all about. So that's a little bit about our kind of health work and how we think about short and long-term missions. Okay, so opening up to the table.
Yeah. So we do want to get to questions. So, you know, please start thinking about questions or share them in the chat box, and we will get to them. But I do just want to kind of open up for a little bit to wrap things up, and have Tracy and Dr. Laura share a little bit of some references to some ethical guidelines and key Christian principles just that are out there, and that we might all want to just keep in mind as we're doing short-term or long-term missions work, service work around the world. So Tracy, do you want to take a stab at it?
So as we saw in the poll earlier, a lot of you probably are familiar with a lot of these resources out there. There are tons of articles, blogs, and books that discuss these kinds of things, more coming out all the time. Some popular ones include When Helping Hurts and Toxic Charity. And this one that you see on your screen, Doing Good Says Who, is one I stumbled across this week as I was preparing for this webinar. Given my strong bias for doing mission in partnership, I was really impressed with this book, Doing Good Says Who. In it, it provides 5 guiding principles for doing good. What they did is they went out and they interviewed hundreds of volunteers, nonprofits, donors, and those they want to help, and came out, synthesized from that 5 principles. And each principle is explained through through storytelling, illustrating the realistic, on the ground, and often messy experience of each principle. These guiding principles for doing good, to me, clearly walk us through how to do mission in partnership. It starts out by stating, looking more closely with deeper respect is the first principle for doing good. I don't have time to unpack it all here, so go read the book. But in summary, the 5 principles are the following: respect and value people, build trust through relationships, do with rather than for, ensure feedback and accountability, and evaluate every step of the way. So I think if you're doing that, you're doing a good job.
Okay, great, thank you. Definitely looking forward to reading that book. So Dr. Laura, I'm going to turn it over to you. I wanted you to share just a little bit, because you went to a conference recently.
Yeah,
where you got to talk a lot about this.
So I went to a conference recently, which was really amazing. Had the privilege of being invited to be part of a group that was discussing the ethics of short-term medical mission trips. And one of the people in the conference was Bruce, who wrote this short-term medical mission trips guidelines based on a lot of interviews he did and a lot of research he did on what were the best practices for medical mission trips. And so he came up with a group of key things for conducting international health activities is prudence, just don't do it, just really think about how you're doing missions, patience, about a lot of times the work we do is not an overnight kind of thing. You're building capacity, not dependency, and it takes a lot more time and work and money oftentimes to build capacity. Authenticity, knowing yourself and your partner, so really the ability to be honest with the partners and yourself, like what can we actually do in what kind of time. To have excellence, like best intentions do not always equal best practices. So best practices are often the hardest to follow. So how do we overall work towards excellence? Honesty, having trust that's earned and learned, that trust that's built up between all of you and our communities, that's long-term work, it's long-haul work, that, to be honest with each other and to be able to share with each other. And then humility, approaching every problem and every situation is that we all have something to learn. And I just thought these were really cool, guiding principles that we've been trying to follow here at AMOS. And, we hope, that all of us can continue to follow these principles.
Great. There's definitely some shared ideas in these two references, and I do just want to say for everyone who's still on the call, we have a lot of other resources that Tracy and Dr. Laura and others at AMOS here have gathered over the years on this topic, and we're going to be sending that reference list out to all of you after the call in the next couple days. So definitely look out for that. If you want to keep digging into this topic. So in the interest of time, I want to open up the conversation to all of you in the chat box and invite you to share any questions that we might be able to answer, or at least have a little bit of dialogue here before we wrap up our call tonight. So, okay, so the first question is recommendations to give to first-timers. Who wants to take a stab at that?
Mm-hmm.
You can start.
Yeah, first-timers. Well, I think hopefully you're not a first-timer soloing it, that you'll have the wisdom and experience of other folks, but maybe a church is just beginning interest and wants to do this for the first time. Preparing before you go is so important. Building some camaraderie and understanding amongst your team, studying the history and the context, getting to know who your partner is, preparing mentally, physically, all of that before you go. I've hosted so many teams, and you can tell a difference. The teams that have taken the time to meet together, to reflect, to pray, to do Bible study, to really prepare for the experience. You can see that difference when they get to the place of going. And there are a lot of resources out there to teach you, to give you ideas for how to do that. So I think that's the first and foremost tip I would give.
Do you want to go ahead and say anything to that, or do you want to go in? We're getting a few more
questions
in there. Yeah.
Yeah. Okay. I think you did a great job of answering that question. We can go to the next one, and it says, we know of your many successes. Please describe a major failure and what you learned from it. Well, that's actually pretty easy. I've had many failures and learned from them. And I think the good thing about failures is that if you can learn from them, then you can get better over time. And I think one of the major failures that we had as missionaries working here was that there was a time when we worked in an organization called Providenic, and we did not take into account all the actors, all the players in that ministry. And so what ended up happening at some point in time was that the partners that we were working with were not aligned with the mission of serving the poorest people. And I think not recognizing in time if your partners aren't aligned with you, because sometimes you just have the imagination or the vision that, oh, everyone you work with is just all going to want to help poor people and help the poorest people. And just, I guess it's just like this bias. You think, oh, you come as a missionary. Like, of course, everyone wants to like help poor people, right? And work in their best interest, and not recognizing that all partners have different reasons for being partners, and not being judgmental either to say like, oh, that partner is bad because they didn't really care about poor people, right? But just trying to recognize, yeah, we're all come to the table with different things, and that recognizing what those different things, and then working with the different partners and recognizing that you have to put a lot more into partnership. I think doctors, we probably tend to be the worst at that, because we want like this instant thing to be done. Like, of course, we have this awesome medical intervention that you will want to use, you know? And of course, it seems so simple to us. Like, yeah, let's just give everyone deworming medicines. That has been proven to help deworm people, you know? I mean, to improve health conditions of children, right? Especially school-age children. But, you know, you realize when you get there, like, oh, how hard it is to make sure every child gets it. You know, there's problems with people thinking, oh, these medicines are bad. They turned a different color, you know, when actually the medicine's so good. So recognizing the complexity has been something we've learned over time, and then trying to work with that complexity, recognizing there's a different context in every setting that we really need to take into account. Even within Nicaragua, there's so many different contexts. So that has been one of our greatest learned lessons, is that you hope you just have one magic bullet, but unfortunately, there's no magic bullet in global health and public health. There are principles though, and that's what we try to follow. Oh, wow.
Dr. Laura, comment on view of measuring the accountability of AMOS, how that has changed over time.
All right. So will Dr. Laura comment on her view of measuring accountability of AMOS has changed over time. I definitely think that over time, there are some principles of accountability that we've always held to be really important. So like financial accountability is important to us. Partnership accountability is important to us. I think initially we didn't have as much capacity to do all the evaluation and monitoring and research that we can do now. Over time, thanks to the donations of many people, I think one of the things that happens in global health, people want to give you a lot of stuff and not staff, you know. I have a lot of mosquito nets now. I'm just kidding. But you know what I mean? People give you tons of stuff, but the actual staff that you need to actually evaluate programs well and to actually implement programs well, the time it takes to actually work with partners requires staff. And so that kind of accountability takes time to build in an organization. We are at the point that we are able to do a lot more evaluation and monitoring research that actually helps not just AMOS, but just actually global health in general, to be able to under some of the things we've learned in terms of like caring for essential care for babies, and how the work we've done with partnering with the government Ministry of Health and actually showing that you can influence reduction of neonatal mortality over time if you partner in a certain way. That kind of research and that kind of accountability is only built off of, I think, long-term trust and people trusting that, yeah, you will find the right way to use the funds to actually evaluate your programs and make an impact. I hope that answers the question. The next question is, how many days do you consider a meaningful trip? That's Tracy's question.
That's a good, usually it's like, how much time do you have to give? I think it depends on the purpose and what you hope to achieve, and maybe, though we're not all about what we're achieving, but sometimes distance in country has an influence on how many days you would spend there. But generally speaking, I think you can have a meaningful experience in about a 8 to 10 day framework.
The next question is, what is a good resource for discussing the history and current events of Nicaragua when inviting North Americans to experience the culture? once again, I pass it off to my my.
I think I might have to get back to you on naming a really good resource.
You know,
you
this
can
is Christy.
yeah.
Sorry, I'm gonna say, you know, we have one of our board members and someone who's brought a lot of students from Chemeketa Community College in Oregon. His name is David Hallett. I'm not sure if he's joining us on the call, but I know he has a really amazing set of resources that he teaches a whole course with the students who actually come on a service trip with us. And so I can see if he'd be willing to share that list with everybody, and we could send that in the resources. Mark Jensen, I think, was on the call, and he might also be able to share some resources there in the chat box. Mark, you've got a lot of experience bringing divinity students from Wake Forest University with us as well. So yeah, we can get back to you guys about some of those great resources. Thanks for the question.
Great, awesome. And then the next one actually says, Dr. Laura, what advice do you have for an aspiring doctor? Is there anything you did in your medical training or general experience that you did that really helped shape you? And is there anything you wish you would have done differently? Oh, loaded question, Luke. Thank you for asking that. I don't know if I can answer it well, but I think you are an amazing aspiring doctor, Luke. And I think that what I did in my medical training that helped shape me was really look for mentors. I had amazing mentors in medical school and in undergraduate. I had Dr. Nina Wallerstein, who's not on the call, but I don't think Dr. Warren Heffron, I think he said he was going to be on the call. I'm not sure if he's there, but I looked for the mentors who were doing amazing things with other people, and like they were people who listened, who had humility, who like really like embodied like Christ's love, right? Like just the love of service and others. And I think being around those people in medical school is what keeps you going, because medical school is hard, and sometimes not everybody wants to help poor people in medical school, you know, it's just not the thing. Some people do and some people don't. So you want to find those people who can inspire you and encourage you. And if I had to do anything differently, I would probably not had a child in my internship. That was really hard. Okay, the next one says, hello, as a college student, I was wondering if you have any information or know about any opportunities AMOS has for years of service in Latin America. I realize this is a little off topic, so you don't have time to address this. I would still greatly appreciate hearing you. And wow, we have some awesome, amazing opportunities for students. So I would definitely encourage you to reach out to the AMOS team, to Christy and her team.
Yeah, Luz, thanks so much for asking. We definitely don't have time to cover all the options right now, but I see that Lydia shared in the chat box the email of one of our staff who works with connecting people who want to volunteer with us to the different opportunities. So definitely email Cynthia. But you can also check out our website, which it will be in a couple slides. We'll put that up there again. And there's a lot of information on there in the kind of get involved section of the website that you can check out for more information. So,
okay, I think this is a question for everybody. The value of hope. Do you see hope? Thank you, Jim, for this question. Do you see hope generated for the long term as a result of short-term mission experiences? Okay, I think all of us have amazing stories about that. I don't know if you want to share first, Tracy and Christy.
I had, when I was doing full-time hosting of teams, sometimes I was surprised at how all the tears that were shed when we would leave a community. But real bonds are made. It's that becoming vulnerable and going into someone else's space. And when I would go back to visit families that hosted team members or groups, they had the pictures, they had the memories. And so I think that what I shared about earlier of people who feel like nobody knows about them or nobody cares about them, that their lives don't matter, to know that to have the picture of someone from the US who knows them and maybe praying for them, that gives them hope, and that helps them maybe raise their self-esteem a little bit more to be able to then work and make change in their lives.
Yeah, I've been on I've been on mission team trips. I've also like been on the aftermath of mission team trips, like because we work long term in the communities, and I can't tell you how important it is that you guys come down and come alongside all of us here at AMOS and also the communities, because hope is so important. That's what keeps us all going, right? And when you are in these difficult situations, like hope is like what, hope is the faith that somebody else believes in you, and that God's there with you, and you guys are bringing God's love with to them as well, and they're bringing it to you. It's like a two-way relational thing, right? And so what I see in the communities is that people are like, they ask me about the communities and about you guys, and then they also say, yeah, because of that community, we were like, because of that team, we were like, hey, why can't we do that for our community too? And it encourages them to like be empowered and start making changes in their community too. We've actually done studies. I know this is super geeky, but we've actually done studies where we found that where there's a mission team, there's more community empowerment and there's more motivation to do more for their communities. And so that's why we actually have a special thing that one of our John Carroll, one of our team members here, he's a community projects and delegation team coordinator. He made it his mission last year to make sure every single community we served in got a mission team, and they did last year. So yay. And it brings hope, it brings love, and I can't tell you how important. Some people are like, just send the money. Yes, send the money, but also come.
Right. I don't know if I see any other questions, and I know we're basically out of time. We're a little bit over, but thank you so much to everyone who has hung out till the end. I do want to just kind of wrap up here. Don't leave yet, because we do want to invite you. If you have been inspired, and we know that there are places all over the world and many organizations and places you could go. But if you are interested in maybe coming and joining, organizing a team or joining a team to come and serve with AMOS here in Nicaragua, you'll get to see beautiful scenes just like this one in many of our communities. And you can contact delegations at amoshealth.org. It's an email to just ask some questions and learn a little bit more about what it would mean to come with a delegation or a mission team. And also, we just want to thank all of you for joining us. I'm so grateful for Tracy and Laura and all they prepared to have this conversation. We've had many conversations with all of the people who have come down just year after year. And you have fed us to keep examining ourselves and be a learning organization and always get better at how we do things here at AMOS. But there is long-term work to do, and there are tons of churches that we're already partnered with, and so many of you are already donors to AMOS. But we just want to say, if you feel inspired and might want to make a contribution to the long-term work we're doing, you can visit our website, amoshealth.org/donate, and that's where you can find how to do that.
Yes.
So
And
not an obligation, but we just wanted to share.
And we
that
also
with
want to
everyone.
thank all of you who have donated and contributed to the work, because this work, which is long-term mission work and long-term community health work, literally wouldn't be possible without all of you. And we just want to thank you all for that and for coming on the webinar with us today. It's awesome.
And we're really grateful. We want to share a special shout out to our staff member Alger and our rest of our team who turned on the power generator.
Yes, thank you, Alger.
We are going to send out the recording. Yes, thank you for sharing, Lydia, after the fact. So if you want to check out the recording, watch it again, and see any parts, you'll free to do that, or share it with someone else who might be interested in the topic.
Mm-hmm.
So yeah, thank you guys so much. We're going to wrap up and say goodnight. Thanks for being here.
Yeah. Thank you. Thank you, and love you guys. Thank you for your awesome comments. We love you too.